All right. So we'll start again. So now we are live and we are now recording and we are also live on Facebook. So thank you so much, guys, for registering for this webinar. It was slightly short notice. We were trying to get the times right. So we are here now with Jonathan Sharps from Switzerland, Lucerne. Am I correct? Lucerne, Switzerland?
Lausanne.
Lausanne. And Jonathan Sharps from UAT, Unified Acupuncture Theory, has given us his time today, his generous time. So we are here for probably around 30 minutes. We are discussing Jonathan's view, his look, and his system, Unified Acupuncture Theory, on emotional conditions and, of course, associated treatments. So just for housekeeping, on the bottom right, guys, you'll have a little chat section. It says type your message. If you want to ask questions, you can type on that and I'll be able to see that. And you should be able to receive a recording after this. It is the first time we're using this particular platform for the webinar, so I hope it, technological-wise, it goes well. Otherwise, we are live, both here and on Facebook. I've got my screen open in front of me on AcuGuys, so the AcuGuys Facebook group page. It's the private group page, so we should be live there as well. And we're looking at... probably about 30 minutes. So, Jonathan, for those of us who maybe it's the first time for us to be here with you and who couldn't attend the first live webinar we did actually on Facebook, can you give us a quick introduction about yourself and maybe your area of work and what UAT is all about?
Sure. First of all, thanks for having me again. It's always a pleasure to talk with you. So about myself, I'm originally Canadian and I live in Switzerland. I've been practicing for about 17, 18 years now. When I first started, I had the chance to start learning from my clinical director who I was studying with. He was somebody who had already studied Japanese acupuncture and Korean acupuncture and Master Tong acupuncture and Dr. Tan acupuncture. So I started with a wide variety of different acupuncture styles instead of being thrown directly into TCM. And then through working with all these different styles, I started to try to look for what is the thread, what is the thing that works or the logic behind all these systems. So the Unified Acupuncture Theory, there are three basic courses to it. And there are two or three main logical sets that we use. And the goal is to find a system and theory that's not only theoretical but practical, which allows us to connect all these different types of acupuncture. So we have the TCM, we have the Japanese meridian theory, we have the Manaka system, we have Korean Sam acupuncture, we have Master Tong acupuncture, the Dr. Tan balance method, and many others actually that I've picked up along the way. So to start with, the UAT is a model of how meridians interact, and we understand their interactions with each other and their effects on each other. We combine that, and then we move that also into the 5-element approach. And when we put them together, we start to understand where all the point indications come from, all the different types of treatments and the treatment ideas and why they work and why this point does that, or why when we do this, this happens. So it's an inclusive approach. It's not where at the end of the course you only have to do what is shown in the course for it to work, like some courses do. The idea is that you have practical information, you have wonderful techniques, treatment protocols, treatment thought processes, but also the ability to incorporate whatever you've already learned or whatever you already do.
That's good. So it's not going to really exclude someone who's done another system. It's going to be incorporative. So if someone actually has done a lot of the, say, Dr. Tan or, Master Tung systems, I guess the question is, and this sort of comes up a lot, how is your system going to incorporate or teach that it is different to how it's being currently taught?
So let's start with for the Dr. Tan, because that's probably what the most people are most aware of. The way the Dr. Tan system is taught is he talks about 5 different meridian systems, and he uses 2 separate logics in why they work. So by doing that is you don't really necessarily understand why you would want to choose one system over the other. With the UAT system, there's one overall theory that allows us to understand how the systems work together. So we get a better understanding of what you've already learned. We also go into, let's say, more detailed or more complex ideas of imaging, where we really get into how creative you can be and you're not limited to only this or this, because normally with the Dr. Tan system, you have 3 or 4 possible images. Here you're going to see you have many more images. With the Master Tongue style, it's going to be about understanding more of the points why they work. One of the main problems I found when I was studying Master Tongue was that it was this point, here are the indications. It was like going back to TCM school, but with different points. So you have a better understanding of the reasoning behind it. And when you understand why you're doing what you're doing, what you do becomes more effective because you're choosing things on better information, and also your intention as to what you're doing improves.
Yeah, that's really important. So point function is one of those things like, you know, we can always say it clears this as a feature or it does indicate it for this particular, you know, disease, but to understand really the dynamics and the, I guess, the pathomechanism and the interactions, it really helps us understand, I guess, why we even get certain treatment results. So I guess you've named your system pretty correctly by unified. It really is unifying a lot of the different systems. Well, that's really good because I put up a testimonial, I think it was last week, from an attendee that came to one of your seminars in Europe, and it was pretty much, she was just saying how she's done many courses of the Dr. Tan system, but I guess what she found from yours is that her ability to implement and execute quickly and understand why she's doing it was really, I guess, the profound advantage she found. So that's good. Thanks for that introduction. So today's webinar is really about, and guys, for those who haven't seen the first chat I had with Jonathan, it's on the Aki Guys Facebook page, and it's more associated with the introduction of Jonathan's system. So if you want to learn more, you can always look at that. It's on the Aki Guys group page. In today's webinar, we wanted to talk a little bit more about emotional conditions and associated treatments for emotions using the UAT system. So I guess the best place to start, Jonathan, is how does your system really look at emotional conditions from your perspective?
Well, so for the emotional conditions, it's more the second and third day of the seminar we're doing in Australia, which is the 4-needle 5-element approach. And I look at what we have from the classic Chinese information of emotions, and I also incorporate a lot of modern psychology into it. So the approach that I take towards emotions is to think about that each emotion is actually, it's a response of the body to an external influence. And what it is the emotion is there to create a response for the body to respond to the environment. So we break it down to the function of the emotion, and we don't look at emotion as being a positive or a negative emotion. We look at it as actually being the body's response. And when that response is either too strong or not enough, that is when it's in disbalance. So we look at not only the idea of, you know, the traditional idea is somebody who's full of anger, you're going to disperse the liver, right? You're going to do liver 2, or we don't look at anger as necessarily a negative emotion that always needs to be dispersed. We also look at it as being something that somebody who doesn't stand up for themselves, doesn't protect themselves, and doesn't have that ability to be, to protect themselves, we're actually going to help them tonify their anger and bring in what we call healthy anger.
Mm.
So what we do is we look at each emotion and its function, and then we look at what are the types of situations where that function can be deficient or that function can be in excess. And then depending on that, we're going to choose the correct pattern to help the patient then better express, either express it healthily or reduce because they're expressing it too much. So that's yeah.
No, go on. Keep going.
So that's more for moments of when the emotion comes up. The other thing I look at is that studies have been done that show that if an emotion happens, you feel an emotion, and nothing gets attached to it, there's no backstory, it's not a trigger for anything in the past. The emotion only lasts for about 90 seconds. That's how long it takes for the body to actually respond. So what we can say is that any emotion that has a duration that's longer than a minute and a half to 2 minutes is starting to become something where you're holding on to a past emotional response that wasn't fully expressed. And in that case, what we want to do is we want to sort of deconstruct what is the reason for the patient holding on to it so that they can let it go and then experience the emotion normally. Because we all experience emotions every day. The problem is that we attach way too much of our past history to them. And it sort of takes us away from the moment. And that's when they become pathogenic, if you want to use a technical term for how we respond to our emotions. So we work on both. We work on getting the patient to have the ability to respond, and then also looking at what are the stagnant emotions that the patient has in the past that hasn't been fully dealt with to help them express them.
Yeah, that's really good because it's sort of, as you know, my area of interest is also in emotions, and we normally look at adrenaline lasting in the system up to 90 seconds, and anything outside of that, we say that you are pretty much justifying your own past as to why you want to carry the emotion. And then we look at the different, I guess, ways that the emotions can penetrate through the Wei level, the Yin level, and into the Yuan source level. So you've said that emotions are responses based on environmental stimuli, and that they're neutral, which means they're not good or bad. It's just the way the organs are expressing your response to that story that's happening outside. So I assume that if it is within that 90 seconds, it's obviously going to be quite easy to resolve. So if we're looking at long-term emotional conditions where there is a past story, how do you see that affects the channel system?
Well, what we'll notice is that we have to take into account some different parameters. First of all, the constitution of the patient. We have to look at, is the patient more prone to have a problem with the spleen or more prone to have a problem with the liver from their constitutional aspect. Then we also look at what was their situation when those emotions were, when the backstory actually happened.
Okay.
We also look at what are the relationships that the person has with the world outside of them in the past and at the present, to sort of understand how do they respond, why do they respond in this way. The focus of the treatment is more as to the present moment and getting them to feel the emotion in the present moment without holding on to their backstory. We don't necessarily have to go through their backstory to release it. Often by just opening up the organ or the fu that is most related to them holding on to their backstory, that process happens by automatically. So we don't have to go into the true psychoanalysis of each patient.
Okay, so that makes sense. So I do look at the backstory, but you're right. So if we're tapping into the correct organ, the correct energy, the correct channels, really, we have the ability to help the body express that. So what kind of channels, and of course everyone experiences emotions differently, but what, in your experience, which channels specifically do you see more of when it comes to emotions that are being affected?
Well, so we break it down to the five basic emotions of Chinese medicine, right? So we have sadness, anger, joy, and fear. And then we put the earth or thinking in the middle. And thinking is our connection to the emotions around us. It's how we integrate them, right? That's the step from feeling to acting.
Yeah.
So I would say is that we have often, if you think about the Po and the Han and the will and the Shen, there's almost like an axis. You have a left-right axis of Po and Han and a north-south axis of Shen and Zhu. So we often find that we have fear and sadness are linked together. So there, if we will be using either large intestine, lung, liver, and maybe gallbladder. And when somebody's overwhelmed with fear, it's often in relationship to a lack of joy. So there we'll be seeing either kidney and small intestine, or we'll be seeing bladder and heart. So we actually use all 12 meridians for emotions, depending on the situation. And in the course that we're doing in Australia this time, we're looking at the basic setups of how they work. And then in the advanced course for emotions, we look at complex emotions when we have 2, 3, or 4 emotions and how we can help one balance the other.
I see.
Yeah, because it's a lot of information just to first understand the 12 at the beginning. You can get really good results with that, you know. And the other thing is then we take the pericardium and the Sanjiao and we use them mainly for trauma. So the trauma is the blocked emotion where the patient's going back to the past. So to rebring the person to the present moment, we're going to be using the pericardium and the Sanjiao. And then for moving all the other emotions around that, we'll be using the other 10 meridians.
So you're using the pericardium and the Sanjiao to really mediate the stuck energy into the present moment, and then using the other channels to actually help express it. Is that correct?
In some ways, yeah. Actually, what I do is I put the pericardium within the UAT system. The pericardium and Sanjiao aren't included in the fire element, but they have their own element, which is called heaven, which is closely related to earth. So you have this heaven-earth axis. And the earth is obviously spleen and stomach. So we use those 4 as the center pivot of, depending on how the patient expresses their disassociation from their emotions. And if they're disassociated, we'll start by balancing the heaven and earth elements, and then they'll start to be able to express their emotions, and then we'll start using the other elements around them. And then normally we go back and then use the heaven earth to then realign them and to help them fully integrate the emotional work that they've done before.
Okay, that's also interesting. So if you have in your system the earth in the middle, and you have the other elements, you said the Hun and the Po sort of horizontally, and then you have, I assume you're saying, the fire and the water above and below. So you're saying that the pericardium and the Sanjiao, being the heaven, is actually above the fire?
It is. It's above fire in that paradigm, yeah. So you actually go from the most yin, which is water, to earth, which is a little bit less yin, but yin. And then if you think about the I Ching, and we think about how we use the lines, so water would have 2 broken lines, so it's double yin. And then you have earth, which is 1 broken line, which is just single yin. And then you have fire, which is double single line. Then you have heaven on the top, which is a single line. So actually you're going from the from the most earthly, the most yin. And as you move up, obviously the most yang is going to be, that has the least influence. So it's actually going to be a single line. And interestingly enough, if you look, one of the explanations for this is if you look at the point pericardium 7, which is the one source point for pericardium, it's called the ancestral mound, right? Or it's the observational mound. And this comes from the idea is what was the reason for the emperor to be allowed to be an emperor in China? Is that he had to get the mandate of heaven. And what they would do is they would go up to a mound above on a mountain, and they would look up at the heavens. And if the heaven gave the emperor permission, if the omens were good, then he would become emperor. So the source point of the pericardium is making reference to this connection to heaven, actually allowing the emperor to become emperor.
Which is also the earth point.
It's also the earth point, exactly. So you can see how by focusing the pericardium in this way, we actually get to see a full complex system. I think one of the most difficult things in traditional TCM was the placement of pericardium in Sanjiao. I remember I was talking to some of my old Chinese teachers, and this was at the beginning. I said, well, what element is pericardium? One of them told me it was wood, one of them told me it was water, one of them told me it was fire. So there's always been this confusion as we went from a 5-element system to a 6-meridian system. And so based on the traditional way of meridian setups, it had to go to fire. Because if you're only going to use 5 elements, it has to go to a yang style element, because the pericardium is above the diaphragm. And if it's above the diaphragm, it has to be associated with a yang element. And in the traditional system, the only 2 yang elements are fire and metal. That's why you can see that through the meridian systems, as those are the meridians that are in the arm, whereas all the other meridians are in the leg.
Yeah.
So between metal and fire, obviously pericardium is closer to fire than metal. But when you bring in heaven and say that that is an aspect of earth, and earth then becomes heaven and earth, which is the original separation of yin and yang, and you put pericardium there, it creates a full picture. So that's one of the bases, that's one of the big changes that the UAT model does. And by making that slight change and bringing in the idea of heaven, a lot of the things that were empirical now become logical.
Yeah, okay. So it is a slightly different viewpoint, but it makes sense, especially if you're putting it into heaven and there's oneness. And you've got the earth on the bottom, and like you say, you're going from density to light. So you're transcending into light.
Mm-hmm. Yeah.
So the actual transporting function of the points, so like the actual, your one source points, the G-clef points, the low points, things of this nature, are you looking at them differently, or are you looking at them the same way in your system?
We're using them in similar ways. We're more concentrated on the 5-element points than on the Luo points and Yuan source points. Actually, we do use the Luo points and Yuan source points in different, also traditionally, and we do have when we're treating pain aspects, we can use the Luo points also for guiding needle techniques, and we can use them in some different ways. But the focus on point function, on point categories, is going to be more the 5-element points. We're going to really look at why the fire point is the fire point and the second point on the yin channel, and why it is the 4th point on the yang chan channels, and how that interplays and how we can actually use that. A lot of the way that we were taught traditionally to use the 5-element points was, so Ting points do this, Jing points do that, Husi points do this. Instead of looking at the dynamic aspect of, we have a fire point on an earth channel, and how does that interact, and what are the points, and how can that really affect it? So that's our main focus when we're looking at the emotional aspects, is to use those 5-element points. Because as we know, the word emotion has the word motion in it. It means movement. So we need to have a dynamic, movement-oriented approach to actually treating emotions. And the 5 element points on the meridians allows us to do that. So we're going to be focusing more on the 5 element points, and then we sometimes look at the Yuan source point and Luo points in connection with that, but that's a secondary approach then to the 5 element approach.
Okay, I got it. So when you use the abdominal palpation, because the course is called basically UAT Foundations for Needles, 5 Elements, are you using the palpation in all your treatments, and is it the same to use the palpations for not just pain but also things like emotional condition?
Yeah, so the abdominal palpation, it comes, for me, it sort of replaces almost the pulse. We use the abdominal palpation mainly to focus on internal problems. So internal problems are functional. We have the functional problems, you can have intestinal problems, cardiac problems, all internal medicine. But then if we look at, in the Neijing, it's stated that 70% of all internal problems come from blocked emotions. So of course, as soon as we start looking inside, we're going to be looking at emotions.
Yeah.
So we use a very simple abdominal palpation technique based on 5 elements. And then what we do is then we also use using the meridian interactions that we study on the first day using the model. For example, if you were to palpate and you were to see that you have a heart is active, there's something problematic with the heart, there's something problematic with the kidney, and there's something problematic with the liver. Instead of having to treat all 3 separately, we look at what meridians we can use to then treat all of them at the same time.
Yeah, great. Yeah.
So, and then because we're doing that, and we're often when we do that, we're using the yang meridian, we're also going to be treating the emotional aspect at the same time. So they all come together, and it becomes this very simple picture. You don't have to, I remember I was studying the Worsley School, and they have these huge flow charts of coming up with every different problem to come to a CF, a constitutional factor, which is great and is useful, but that's a huge amount of logical work to get there. Whereas this is much more simplified and it's much more patient-based. The patient felt pain in these points, so those are the points that you need to work on. You're going to look for the points that are associated with that, and then you come back and you'll find a direct change in the abdomen.
Wow.
Right. So that's the.
I'm just conscious of your time. We've probably got a few more minutes.
Yeah.
I think I got a couple more questions. So I've seen some of your obviously video testimonials, but also I've seen your other videos where you're actually treating people in your seminars. So some of actually all the treatments that you put up that I've seen on the videos, they respond pretty much immediately with the 4 needle technique you use. You do the palpation in the abdomen, then you check the points, you do the needles, and then you check the response, and it's almost immediate. So with the emotion side of things, I know that you're saying that your palpation that you're using is basically in replacement, maybe not totally, but with a pulse. But you find those blocks in the abdomen, and someone comes in for anxiety, for example, and you remove those blocks, you do the 4 points. Are you also seeing pretty immediate results with whatever they're feeling?
Yeah, definitely. The majority of your patients, when they walk out of the clinic, they'll almost feel like they're stoned, right? They're going to feel much calmer. They're going to feel much, much lighter. And that carries on. And for a needle technique, very often they're going to have even emotional responses on the table. They're going to start crying. They'll start feeling anger coming up and leaving. They'll start to feel joy. They'll start to feel many different things that normally they've blocked themselves off from.
Okay.
Yeah. I was doing a course a couple weeks ago, and normally the thing is that when we're doing the demonstrations in a course, I always protect the patient from having a huge emotional response, because it can be very sensitive. And that's the patient says, yes, I'm ready for it. So I was doing that a couple weeks ago, and the patient started crying on the table. If you open up the space for it, you'll get that response. right? But you
Okay.
always have to make sure that you're protecting the patient, and that's one of the things with the demonstrations. It's different than the clinic, right?
Yeah.
So unless
Yeah.
that
Absolutely.
patient is fully open to it and and wants it, I know I almost never suggest it because it's unfair to put a patient in that situation in front of so many people.
Yeah. Sure. Sure.
Yeah.
And so, what sort of conditions do you see a lot of? Like, I mean, you've got the standard anxiety, the stress, PTSD, depression. Is there other conditions related to the emotions you see? Things
Yeah.
like eating disorders, for example.
So we see a lot of eating disorders. I work a lot with trauma. I work a lot with um, early childhood trauma. So, and the ways, so that can come into, that can be addiction, that can be self-hate, that can be, as you said, eating disorders. It can be behavioral disorders. Um, with children, also, it can be concentration. The realm of how an emotional, what we treat is vast. It's all ways that people respond to emotions. It can even become
Okay.
pathological, something even to the point of Parkinson's or worse. We still treat it as an emotional problem.
Oh, that's great. So you're definitely seeing
Yeah.
a variety, not just, I
Yeah.
guess, a standard anxiety or depression.
No, that's often what that's what most people think about. But I work in concert with a lot of psychologists. And often the psychologist is when they find that they can't work anymore with talk therapy, they send them for acupuncture. It opens up the body and allows that connection to really work. And we find that when we're doing the two of them together, the treatment will go instead of for 3 years, we can probably work with the patient within 6 months, they'll have the same result. So,
Yeah, that's
yeah.
That's really good. So I just got to, I know we had about
hmm
half an hour because you're actually
Yeah,
in clinic. You're between patients at the moment.
exactly. I have a patient right now who just walked in, so we have a couple
Okay, so
minutes, but
finish up.
yeah.
Yep. Can you just give us a quick summary of the 3 days? What are we covering on day one,
Yeah.
day two, and day three next month?
hmm So day one is the UAT Foundations course. So we're going to be looking at how we build the model that I talked about earlier, and we're going to be looking at how to implement it. There's going to be lots of case studies, lots of patient. The participants are going to have to think about how would I treat this using this information. So that's an applied course, and that's mainly working with pain or local conditions. Local conditions can be just where it's localized in one area. It doesn't necessarily have to be pain. It can be dermatological. It can even be uh, internal, but at one particular place. And then day two and day three are the 4-needle 5 elements. So we're going to look at how we build up the 5-element theory based on the traditional SAM approach, how to incorporate the UAT model, and then we go through a series of 48 different patterns. So we're going to tonify each meridian, we're going to disperse each meridian, we're going to tonify the yin and tonify the yang. So there's 4 different possibilities for each meridian, and then there's 12 meridians. So we're going to look at 48 patterns, and how to do abdominal palpation is also in the second and third days. And the
Great.
emotions are also in the second, third days. So the second, third days are really dense, but lots of practical, right? Everything I teach with, the next day you can put it into practice in your clinic.
That's great because that's important. We all like
Yeah,
to learn, but also we want to be able to implement and execute the
exactly.
right away. That's great. Okay, well, I'll just have the dates for those who are interested. We have next month, really. So the early bird actually ends tomorrow, guys. We have the early bird deal for $865. That includes GST. So you're actually saving $300 because the full price is $1165 Australian. So 865 is the early bird that ends tomorrow. And the dates we have Sydney, the 7th, 8th, and 9th of February, so next month. And then we have Melbourne, and that is the 14th, 15th, 16th of February 2020, so next month. After this, you'll receive a link on all the information you need. Otherwise, you can always go to needlepro.com.au. That's needlepro.com.au. Under seminars and workshops, you'll see Jonathan's workshops there. We are also, for those who are not aware, $5 from every sale this month for Needle Pro actually goes towards the CFA and the WIRES Animal Rescue Foundations to help out the people who are suffering. And because of the fires in New South Wales, Jonathan's actually extended the early bird for one more week for Sydney attendees. Melbourne's almost sold out, guys. So if you are interested, you need to get on board quickly. But we have a few more spaces for Sydney. And like I said, Jonathan's allowed us to extend the early bird until next week. So, Jonathan, thank you so much for your time. I know you're between patients, so I really appreciate it. I have the recording, so hopefully we can get the recording sent out to those who couldn't register. But yeah, it doesn't look like I have any questions yet. But if they come through, I'll make sure I pass them on to you. Otherwise, thank you guys for watching. Thank you guys on Facebook as well who are live with us. And thank you, Jonathan, again. And we look forward to having you here in Australia next month.
Yeah, I'm looking forward to it.
Okay, well, I'm just trying to see if I've got the call to action to come up. Anyway, if when we log off, I'm sure the page will come up with all the details. So, okay, thank you again, John.
My pleasure, and I'll see you soon.
See you guys. Thank you, guys. Bye-bye.